Now, with stronger measures in place to protect yourself coming into contact with someone carrying the coronavirus, preventing human-to-human transmission is now very closely under the microscope, so to speak. Our Lee Seung-jae has some tips on what you can do to protect yourself if you suspect someone in your household is sick.
Self-containment refers to literally quarantining someone suspected of a virus infection at home and preventing them from going outside. There are many things to keep in mind when a person and their family share the same space. First off, it's highly recommended that they use a single room, meaning if you have your own room, you should be the only one using that space. If that's not the case, use a separate bed or at least stay 1 meter away from the other person sharing the room. Shared spaces such as bathrooms and kitchens should have the windows open as often as possible to release any contaminated air. Instead of towels that family members share after washing their hands, it's recommended that disposable paper towels are used instead. While carrying a handkerchief is good, it's advised that you dispose of it after a day's use. If you don't want to throw it out, it's recommended that it's washed using laundry detergent and machine, washing it at 60 to 90 degrees Celsius. You must always wash your hands after discarding your face mask and disinfect areas you touched with your hands.
In particular, things like doorknobs and office supplies are highly likely to spread the virus. It's important to wipe those surfaces with disinfectants 1 or twice a day.
Parents taking care of children who may be sick should also follow strict guidelines to protect themselves. It's important to wear a medically approved face mask that fits you and your child's face. If any member who's being self-contained develops acute respiratory symptoms, fever, or shortness of breath, you must dial 1339 right away. It's important that anyone who shows symptoms to stay at home until the health agency confirms the symptoms have gone. While it's more difficult for newborns or parents of newborns who may show symptoms, the Korean Medical Association says it's important for the sick infant and their parent to be self-contained together. Lee Seung-jae, Arirang News.